Hey guys, hello and welcome to Speedy Medical. In this video, we are going to take on the plasma cell dyscrasias. See, this is a very important topic and plasma cell dyscrasias are highly tested in the step examinations. So I would recommend you to spend some more time on this topic. So plasma cell dyscrasias are actually the disorders that arise from the plasma cells. And as you already know that the plasma cells, they arise from the B cells within the bone marrow, and the whole job of plasma cells is to produce the antibodies and provide what is called as humoral immunity. So if we talk about the plasma cell dyscrasias or the plasma cell disorders, in these disorders there occur the neoplastic proliferation of these plasma cells, and there are various disorders of plasma cells, and the important ones are the multiple myeloma, monoclonal gammopathy of undetermined significance, and Waldenstrom macroglobulinemia. In this video, we'll primarily discuss the multiple myeloma, and in the subsequent videos, we will discuss the monoclonal gammopathy of undetermined significance and the Waldenstrom macroglobulinemia. So let's start the video with multiple myeloma. Now if we talk about the multiple myeloma, in case of multiple myeloma, there occurs the neoplastic proliferation of the plasma cells within the bone marrow. So in case of multiple myeloma, there will occur the neoplastic proliferation of the plasma cells. So as a result of the neoplastic proliferation of the plasma cells, the whole of the bone marrow will be infiltrated by these plasma cells. Now if we talk about the etiopathogenesis, the exact pathology or the exact pathogenesis of multiple myeloma is not known, but it is believed that the multiple myeloma is caused due to the high level of interleukin 6, and it is seen that in case of the multiple myeloma, it is the elevated level of interleukin 6 that is driving the neoplastic proliferation of the plasma cells within the bone marrow. And in fact, the multiple myeloma is the most important cause of primary malignant tumor within the bone marrow. That is, it is the most common cause of a malignant tumor that is arising within the bone marrow itself. Now if we talk about the clinical features of multiple myeloma, there are various clinical features of multiple myeloma, and I will try to explain each clinical feature in detail. Now the first clinical feature is that there is a bone pain with hypercalcemia. So there is bone pain plus hypercalcemia. Now it is believed that whenever the neoplastic proliferation of the plasma cells occurs, these plasma cells will secrete a cytokine which is called as the rank ligand, and these rank ligands, they will bind with the rank receptors which are present on the osteoclast, and as a result of this there will be stimulation of the osteoclast, and as a result of the stimulation of osteoclast there will be increased bone resorption, and as a result of increased bone resorption there will be hypercalcemia, because the calcium is being flooded into the bloodstream. So as a result of this there is hypercalcemia. So this makes the first clinical feature of the plasma cell dyscrasias or the multiple myeloma, that is, there is bone pain plus hypercalcemia. Now if we talk about the second clinical feature, it is that in case of multiple myeloma, there is elevated protein in the blood. So there will be elevated protein in the blood. Now you know that these plasma cells, they produce the antibodies, and antibodies, they are the gamma globulins. As a result of the increased synthesis or the increased production of these antibodies, the globulins in the bloodstream, they will increase, resulting in the increase in the total protein within the blood. Now if we do the serum protein electrophoresis, in which we can see the levels of the different type of proteins within the blood, there will be a characteristic spike which will be due to these globulins, and it is called as the M spike. Also, there is very important point to consider that in case of the multiple myeloma, the globulins which will be produced will be of only one type. This is because a single clone of the cells is proliferating, and you know that one type of cell, they produce only one type of antibody. So therefore there will be antibody which will be of only one type. Therefore there will be a characteristic spike like this, and this will be called as the M spike. Now you might be thinking which type of antibodies they are produced, because you know that the antibodies are of IgA type, IgG type, IgM type, IgE type. In case of multiple myeloma, the antibodies which are produced are primarily of IgA type or IgG type. So therefore this M spike is due to elevated level of either one type of IgA or one type of IgG. So this makes the second clinical feature, that is the elevated total protein within the blood, and among that protein it is the M spike which is characteristic, and the M spike is because of only one type of particular IgA or IgG. The third clinical feature in multiple myeloma is that there is anemia. Now anemia is basically due to the infiltration of the bone marrow by these plasma cells, which will disrupt the normal hematopoiesis which was going on in the normal bone marrow, and as a result of this there will be decreased number of RBCs which will contribute to the anemia. Also in case of multiple myeloma, there is increased risk of infection. Now you might be thinking that why is there increased risk of infection when the antibodies are produced in such a large amount? This is because these antibodies, they are lacking the diversity. That means these antibodies, they are of only one type, and therefore they can react to only one type of pathogen or the microorganism. Since we are lacking the antibody diversity, therefore there will be increased risk of infections in case of multiple myeloma. Now moving on further, there will be an increased risk of Rolex formation in case of the multiple myeloma. Now basically, if we take on the bloodstream, the RBCs, they are separated from each other, but in case of multiple myeloma, there occurs a disruption in the charge barrier which was repelling both the RBCs from each other. So as a result of this, there will be formation of stacks or piles of these RBCs, which is called as the Rolex formation, and this loss of charge which was repelling each other is due to the increased level of proteins within the bloodstream, and this increased level of proteins within the bloodstream is due to multiple myeloma, as you already know. So therefore there will be an increased risk of Rolex formation. Now in case of multiple myeloma, although the antibodies, they are produced, but characteristically the light chains of these antibodies, they will be deposited at various places which can lead to amyloidosis. So there is a disorder which is called as amyloidosis, and in case of amyloidosis there is a deposition of various types of protein and which have particular properties, like they are stained by Congo red staining, and they can be seen under plain polarized light in which they can show various patterns. But you have just to remember that in case of multiple myeloma, it is the proliferation of the light chain which is causing amyloidosis. Also these light chains, they will be excreted in the urine, and as a result of this there will be protein urea, and these proteins which are excreted in the urine, they are called as Benz-Jones proteins. So you have to remember that these Benz-Jones proteins are nothing but they are the light chains of the immunoglobulins which are secreted in the urine or excreted in the urine. Also these proteins, they can deposit in the distal tubules, and they can literally block the tubules, which can lead to renal failure, and such condition is called as myeloma kidney, in which we have the kidney failure or the renal failure. Also there is hypercalcemia, and the calcium may also deposit in the tubules and lead to the formation of calcium stones, which can also deteriorate the functioning of the kidney. So within the multiple myeloma we can have the renal failure, and it is a very common problem. So this was the whole idea of the multiple myeloma. I hope you like this video. For more videos like this, to subscribe to our YouTube channel.